Noted by the Canadian College of Health Leaders, a leader is anyone with the capacity to influence others to work together constructively. In such an important field like healthcare, we need leaders who can do just that, and those leaders need support. And nothing supports better than a community that develops and inspires. Speaking with me today is CEO of the Canadian College of Health Leaders, Alain Doucet, who's going to fill us in on what the CCHL does and how it's helping to groom the future leaders in healthcare. Awesome, right on. Well, thank you so much, Alain, for joining us today and sharing what the college is doing. You guys have had some great things happen over the last couple of years, despite the hurdle of the pandemic and whatnot. So first off, I'd like to just start with, how are you and how are things?
Things are pretty good. You know, we keep a pretty close tabs on not only the health of our staff, but of our members, of course. And, some of our members were hurting, and we've really made a point over the course of the pandemic to be a place of support and a place of encouragement. But we also keep a very close eye on our board, our staff, our collaborators, and making sure everybody's as okay as possible. So I'd say we've come out of the pandemic, to the extent that we're out, pretty well. And I'll admit that at the top of the pandemic, we were a little concerned, and we were wondering, when's the other shoe going to drop? When's the bottom going to fall out? Is everybody going to go silent on us? But I think we did a very good job of providing value, staying relevant, and as you and I were chatting before we went on air here, we've had record numbers of new members in the last couple of years, so I guess we're doing something right.
That's great to hear. So maybe give me a little bit of a rundown about what the CCHL actually is and what it is you guys represent.
Absolutely. So we're a national member-based nonprofit association, coast to coast, 20 chapters across the country, national programming, regional programming, chapter level programming, and 4,500, depending on the time of year and how you count it, but 4,500 individual members, 80 corporate partners, and we represent health leaders of all ages, of all degrees of seniority, historically focused on acute care or hospitals, but now more and more trying to move what we call across the continuum to other parts of the healthcare system as much as we can. And, our job is to be a connected community, a place of professional development, support, and inspiration for health leaders across the country. We are what I call an entrepreneurial association. That is, we have 7 lines of business, and we generate every dollar we spend. So we have no guaranteed funding. We have no federal or provincial or other grants. So we worry about both sides of the profit and loss statement, if you will, which means we engage, we generate revenue, we build programming, we support our members, and try to do so in a fiscally responsible way.
Right on. I was just going over your website. You guys have a lot of key focuses that you do with education. You're really encouraging on anybody really in the healthcare industry to step up their game and step forward to receive mentorship, receive education from the college. Can you speak a little bit to some of those key focuses that you guys work? You've mentioned a few already, but then also how you validate some of those things with your certificates and so forth.
Exactly. You've done your homework. It's terrific. We call it leadership where you stand and where you sit. It's not hierarchical. It's not about being an executive. It's not about being a VP. Everybody can be a leader in their own right. And so we actively recruit students in master's programs, Masters of Health Administration and such programs with 30 academic partners across the country. So we try to intake students, young leaders, recent graduates, mid-careerists, senior leaders, and executives. And so really try to impart a sense of career development, professional development, opportunity, and a sense of support. And so once people join, they can attend our webinars, they can attend our conferences, they can take some of our courses that in some cases lead to partial completion of the requirements for our certified health executive. designation. And of course, once you have your designation, you need to maintain it like any professional designation. And so on an ongoing basis, people can continue on a journey of lifelong learning to maintain their certification. And of course, then we have community, we have chapters, we have get-togethers, we have networking, and we have people who are in reality or virtually can hug or high five or shake hands or whatever, because in any industry, but maybe in healthcare in particular, and maybe more recently in particular, people need support. We sometimes call it, doing stuff with more holding hands and less talking heads. And so it's all about support. As you said, there's a series of things that people can do: 360 assessments, taking our leads-based courses, and thinking their learning through and writing papers that lead to the professional designation. And so, as you said, the validation of all the work you do can lead to your certification. It's the only health leadership certification available to all health professionals, regardless of your academic training, your clinical background, where you work in the system. And so we're truly national and agnostic, if you will, in that sense. So hope that answers that question.
Yeah, absolutely. And it's great to see something like this because there's something we need the most of is uniformity when it comes to healthcare. Like everybody has to be on the same page. So seeing that certification is recognized across the board is really great to have because it's just recognized by everybody. Super awesome to hear about your involvement with the post-secondary educations as well. It's one thing that comes up on the show about just bringing development of people coming out of these secondary educations and finding a place in the workspace and having support. So it's really great to hear that you guys are actively engaged in that. So great job on your guys' part. Is there anything like in the recent wins? I know COVID's been a hurdle, but you had that growth in membership. Any other kind of recent wins that are noteworthy and maybe surprising for you that you may have seen across the country?
Yeah. Before I answer that, I want to go back to something you just said about common language. And so you're absolutely right. We encourage employers, hospitals, health authorities, regional authorities, long-term care, to make the CHE a requirement of their hiring practices. So they don't do this across the board, of course, but we sure like it when they do. One of our main partners, amongst others, is the Canadian Armed Forces Health Services. And so the Surgeon General of the Canadian Armed Forces is on our board, and there's always a military representative on our board. And to get promoted within the health system of the military, you are encouraged, or in some cases must have a CHE. So there's really alignment there on this common standard, common language. The other aspect of our common language is our LEADS framework. And so we are co-owners with Dr. Graham Dixon, who's the initial author of the LEADS framework, of a unique proprietary healthcare-focused leadership development framework. LEADS, 5 modules. A lot of our pedagogy and our mapping and our engagement, our professional development is mapped on these 5 dimensions. We had a conference just yesterday, our Ontario Health Leaders Summit, and we talked about the D and the S of LEADS. So lead self, engage others, achieve results, develop coalitions, which is a really big thing we've seen during the pandemic, and systems transformation. And so if you've taken LEADS development, you've taken your CHE, you can go from working at Alberta Health Services to Saskatchewan to University Health Network in Toronto. And if you go into an organization that is LEADS based and who does their professional development based on LEADS, you've already got a common language around how to think about leading the organization. So back to your more recent question is...
Well, no, I want to speak to what you just said. I'm going to interrupt you really quickly because that was what you mentioned is so great. Because when you're pulling, everybody's pulling in the same direction. And they're all with a common goal and they're all under the same education. You can start moving mountains. And in the healthcare industry here in Canada, I think we saw some opportunities with the pandemic coming in of just having a uniform message from coast to coast
Hmm.
and knowing that we are all on the same page and this is the action that needs to be taken care of because we all have the same
Right.
education.
Right.
That's a great thing, and I think it's good to know that that information is out there and that that is the initiative that's set forth and that's in action actually. So good on you guys.
Absolutely.
That's fantastic.
Absolutely.
Yeah.
Absolutely. Yeah.
So yeah, we'll
Can I
jump
go
over to
back to
the
your other
recent wins.
go back to your other question? Well, um, so win number one for us was, um, sort of overcoming the concern of what is this going to look like in the pandemic? Like, this is
Mhm.
discretionary. People don't have to do this. There's a cost often and a time. And how far and wide are people going to get tugged in the context of the pandemic? Because I mean, think back a couple of years ago, we did not know what this was going to look like. We did not know how this was going to play out.
Yeah.
But we kept our ears to the ground. We used member feedback. We tried to be responsive in real time. We shifted a lot of our content towards things that were relevant in the pandemic context. So, talking about resilience and emotional support and leading in a crisis. We did research and published papers on leading in crisis, built a 4-stage model on how to think about
Wow.
leading in a crisis. And so, win number one was not letting the bottom fall out
Mhm.
and maintaining our relevance and responding to the fact that, in fact, leaders were not flocking away, they were flocking towards us. Why? They needed support, they needed a break, they needed to hold hands.
Yeah.
And so we did that. And the result is that we've had 2 record years of new member acquisition. We've had record numbers of CHEs graduated and registered in the context of the pandemic. And we've had sort of a real feeling of being connected with people and being supportive. All that, despite the fact that we've switched everything to virtual and we actually haven't been in the same room with any of our members in 24, now going on 25 months.
Yeah.
We've saved some time and some effort and some energy, if you will, by not traveling as much. Had to adjust to doing what you and I are doing here right now.
Yep.
And what we've done is we reinvested that time and energy into redesigning and relaunching our CHE designation, relaunching our fellows, rewriting and making more contemporary our code of ethics, um, and more, more importantly, more recently, launching a new member engagement platform called the CCHL Circle. So it's one thing to say to people, come and join the college, engage with your chapter, used to be in person, now virtual, going back to in person, come to our conferences, take our courses. But what we've done now is we've done a purpose-built, engagement-focused platform called CCHL Circle. So your members can come on, activate their account, they choose a level or they get assigned a level depending on their designation, and they can find other colleagues, engage in offline conversations, participate in online discussion forums, engage in a mentorship relationship, become a mentor or a mentee, sign up for our events and all that kind of stuff. So we now have 1,000 people engaged on this platform. We're gaining about 70 a month. And so that's the most recent win. The last thing I'll say is through the course of all this, we postponed our strategic planning process twice. Just because, and we just couldn't do it. And we had other more immediate concerns. And so in the past year, we've done a member survey. We did a strategic visioning exercise. We did a strategic planning process with our board and with our various councils and our members. And we've come up with a new strategic plan now guiding us through to 22, 23, 24, 3 years. And this is where I said earlier, our purpose in life is to be a connected community that develops, supports, and inspires leaders. So that's our new purpose statement, our new values, and 3 priority pillars. And so being a connected community, being a national voice for leaders, and helping them on their career journey. So that's kind of like everything we're about and everything we're doing going forward. So a lot of wins, you asked, and there they are.
Well, you weren't sitting on your hands, that's for sure. You guys
No.
achieved a lot. You still
Yeah.
kept engaged, which is fantastic to hear. And then, I mean, doing that survey to help you write that strategic plan, hearing what your members are looking for,
Yeah.
like every organization, we're seeing more and more of that, where the
Yeah.
leaders are looking out towards, because they're looking towards the future leaders, and their future
Right.
leaders are the people that are under, like, not to say underneath them, but that are coming up in the ranks, and asking them
Exactly.
their opinion so that they can help mold the future is
Exactly.
yeah, it's just a win-win for everybody.
That's right.
So
That's
with
right.
all that work done, I mean, you guys have kind of, well, I'm curious actually, before I ask my next question, because of the pandemic, you guys have had a chance to see how kind of everything is working, all the information that's needed to address something like this in the future. You mentioned that you wrote a lot of articles, you had some papers,
Yeah.
white papers on responsiveness, mental and social health. Um, w- that kind of sets you guys up to be an educator in the event that something like this arises again, or how to
Right.
avoid something like this. Would I be right in saying that?
Well, yeah, sort of. I mean, look, we're not clinicians. We're not, and then
Right.
the big word here is epidemiologists. We're not infectious disease people. We're not population health experts.
Gotcha.
We're here to support leaders in all of those realms, right? And
Right.
so, um, yeah, prevent, predict, somebody else's job, but that's hard to do for anybody, right?
More of an
So,
exercise of
um,
handling, I guess.
well, exactly,
Yes.
exactly. So Jason, our director of research, at the very beginning of the pandemic, I'm going back to March of 2020 here, right? So
Okay.
I could never remember quite the year when
Yeah,
all
I
this
know it all
started.
blends
Uh,
together.
yeah, so March of 2020, um, started a research project. So he did what I would call sort of rapid response,
Mhm.
sort of rolling survey kind of research, and he'd reach out to a bunch of leaders. He'd ask 3 quick questions. He'd codify it. And he'd go back. He'd use some of it in a webinar. He'd come back. He'd ask more questions, and eventually he cooked up what we're now calling his 4-stage model of leading in a crisis. And
Wow.
so we've used that repeatedly in webinars. We use it in our courseware, and he's going to keep it sharp and keep it current and keep it going. And so when the next, not to sound gloomy or anything like
No.
that, but when the next crisis hits, whatever it is,
Yep.
we'll be partway there.
Yes.
Now, you always want to kind of contextualize and make it current, and is the world changed and what's the environment? But we have this 4-stage model. It's now part of our toolkit.
Hmm.
It's part of the toolkit of a lot of leaders in how to think about this and what are the things you need to think about and do at stage 1, stage 2, which is the acute stage 3, which is recovery, and so on and so forth, right? So we've done a lot of that work. The work we're doing now, sort of rolling forward, is to think about the things that have been exposed in the pandemic.
Hmm.
And so long-term care. So a lot is being said about how horrible that was and how unprepared they were and how long-term care needs to be reinvented. So our job is to say, how can we figure out what is better leadership in good times and in bads, in crisis and in regular times, look like in the specific environment of long-term care? Because
Hmm.
it's not the same as a hospital, right? Family involvement is different, community involvement is different. The patients are different. They're there longer in many cases,
Yes.
and they have different needs. So what does leadership look like this? So we've started focus groups, think tanks, and work on what does that look like, and also thinking about we've seen a lot of retirements of health leaders in
Oh,
the last little
right.
while. People who've accelerated their retirement or are finding retirement when they put it off.
Hmm.
Bring in the pipeline of young leaders, and then there's a gap. There's like the C-suite is getting empty. A lot of people mid-career is getting promoted, and then how do you support all that? So that we're doing research on gathering evidence on how that what that looks like, and so that's part of our future. I mean, I know you're in Alberta, and you tend to try to focus on Alberta. So just a couple things about Alberta, if I can, to
That'd be
say,
great. Yeah.
yeah, I mean, Alberta is 15% of our membership. And so I don't know if that's the normal proportion, but Alberta has been very, in general, Alberta Health Services, and all the health, the health leaders there, the team that supports leadership development, who we know really well. Verna Yu, well, now the outgoing CEO of Alberta Health Services, and our two chapters, one in Calgary and one in Edmonton, very engaged with the college, very active, a lot of members. And, like you said, 1 out of 6 member nearly of the college is working, delivering care in Alberta. So there's been a big commitment in Alberta and from AHS on leadership development, and we've done a lot of work with those folks. And there's a lot of places where Alberta Health Services in Alberta leads the way. We just recently supported a project and a paper that was presented. We did a webinar on this just last week on supply chain. You remember all the talk about masks and gowns and PPE and supply chain issues. Well, the paper basically said it's all over the place. It's jurisdictionally challenged because it breaks down by province and then by region. The practices are all over the place, from relatively advanced to not advanced at all. But the leader in digital infrastructure for managing supply chain is Alberta.
Wow.
And so there's a lot of good happening in Alberta. There's good stuff happening everywhere. But if there's one thing you might want to be aware of, is that on things like digital infrastructure for PPE and for supply chain, Alberta is where it's at. And this particular paper says, look at what Alberta is doing. Maybe the rest of the country can learn a thing or two.
Oh, wow. Well, we appreciate you saying that. And thank you for bringing up Alberta in the entire conversation. I love to hear that we've had an impact. And I know that other provinces are doing some really great things as well. And it does, when you're in a situation like this, it's not just one province, it's not just one person, it is the collective. And that was a big reason for us wanting to reach out and talk to you guys, was the fact that you do stretch across the country, and that you're trying to keep a uniform messaging and a uniform activism towards the betterment of everybody. And that's such a great thing to do. So that we really appreciate that. So, man, Alain, thank you so much for coming in and talking to us today about this, giving us this information, telling us what you guys are all about, and the great work that you guys are doing. Hope to see more in the future. I know your strategic plan, I'm sure with all the input that you've collected, is going to be really impactful into the coming years, and then helping us mitigate and manage, God forbid, a situation like we've been in the last couple of years, or any other kind of crazy scenario that we might find ourselves in. Having your team and the people that you educate prepared and all on the same page can only manage a crisis and make it less painful. So,
well, the leadership challenge now is, I guess, the closing statement would be it's about learning. What are the silver linings? It's about learning, right? Making better supply chain, better teams, better resilience, a culture of retention for clinical leaders, filling the leadership pipeline, and identifying what is the crisis and how to respond to it more quickly. How do you go from participative, leadership to command and control? How do you switch back? These are all things we've been talking about for the last couple of years. Yeah, we want to prepare for the next crisis, but really what we want to do more than anything is learn from the current crisis.
Yes.
And improve the system. Because when I quiz my team and I go why are we here? Well, we're here to bring better leadership to the Canadian system, so that your aunt and uncle, your kids, all of your friends and family can get the best care that they deserve. And at the end of the day, that's why we're here.
Yeah, and that uniform education, if you're mentoring or bringing leaders up the pipeline, like you said, and you've got a leader that has to step forward into that commanding presence, knowing that they've got someone that's educated on the processes that are needed to be undertaken if they have to step into a commanding role, and they've got that someone that they're underneath to support and is on the same page. Man, that's how you're effective. The whole, like I said before, the whole thing's moving the same direction and together. There's no weak links, and that's what we need. So excellent.
That's what we try to contribute. We support leaders, inspire them, make them better every day in little bits and pieces. And so I appreciate your questions, and thank you for giving us this profile.
Right on, absolutely. Thank you so much, Alain, again, and continue the great work, and stay safe.
Thank you very much. And people can find me on LinkedIn, on our website. If you want to reach out, just let me know where you're at and what we can do for you.
We'll have all that in the link below the video as well. And I know you're a very public person and you don't mind being engaging. So that's awesome to see as well. All right. Okay. Take
Thanks very
care.
much,
Thank you
Bryce.
again.
Thank you. We'll see you soon.
You
Cheers.
betcha.